Tennessee's COVID numbers linger near record levels, there are some sobering words from Tennessee's Commissioner of Health. "We have to learn to live with this," said Dr. Lisa Piercy, and that, quote, "that requires a significant amount of personal responsibility." State Capitol reporter Chris Bungard spoke with Commissioner Piercy, who is also urging caution ahead of Thanksgiving.
The tone was set early at these budget hearings that much of the discussions would focus on the state's response to COVID-19.
The call for people to shut down the economy, that's a non-negotiable for us. We have to learn to live with this, and that does require a significant amount of personal responsibility on every individual's effort.
Those words this week reflect the Tennessee Health Department response to COVID numbers that linger near record levels for cases, hospitalizations, and death. There have been things done to address staffing shortages to deal with COVID patients.
The hospital staffing assistance grants, the COVID-specific units, and lots of other contract agency staff support is what we're trying to get to hospitals to make sure they have those beds staffed.
Just as critical are the plans families are making for Thanksgiving. Some fear COVID could spread rapidly during the holiday. The Health Department commissioner thinks about precautions.
I don't live in some bubble that doesn't affect me either. So we're having these exact same discussions in my house. Do we do it in smaller groups? Do we do it outdoors? What do we need to do with our older family members to protect them? These are the conversations that my family's having and every family should be having.
It's probably the first time a cautious note for Thanksgiving has ever been heard at a governor's budget hearing. Reporting from the state capitol, Chris Bungard.
Now, on a more hopeful note, the health commissioner said there's a chance limited numbers of a COVID vaccine could be in Tennessee by late next month. Those in long-term care facilities, medical workers, and first responders are potentially among the first who would get the vaccine. It might be available to the general public by spring.